there's more coming in. Okay, this is what happens when you're trying to manage, host, and run. As you know, David, a meeting. All right. So I would like to welcome David along. David is the author of Positive Medicine, and I love the title, Disrupting the Future of Medical Practice. And David, I'm going to let you tell a little bit of your story about how you came to be a GP into then an occupational physician, and then how you came to create Positive Medicine. And if everyone else can just put their microphones on mute while David's talking, we'll certainly have time for question and answers later, but it just helps to focus and concentrate.
Are you okay if I share screen? I've got
absolutely. I have allowed permission for screen sharing, so hopefully, yep, that's all good.
I'm not sure if I'm muted, Helen. Feel free to mute me.
I will mute you, although you probably don't need to be muted, I'm hoping, but
it's always one.
Oh.
We can see your screen, David. That's all good.
Cool. So I actually thought I would use as a format for this talk, a talk I gave at the Congress of the Royal Australasian College of Physicians 3 weeks ago in Sydney. And the importance of this is that I was presenting it to doctors, to my own colleagues. And I was challenging them deliberately because, as Helen has hinted at, my mission is disrupting the future of medical practice. So I'm a disruptor. And the main thing I'm disrupting is doctors. And, oh, I can hear you saying, about time too.
I was thinking there's a lot of disruptors here tonight, but so you're in good company.
Excellent. About 2 minutes before I joined, Helen flicked me an email and said, I've thought of a couple of questions for you. And I hastily came up with a title for this particular talk, which is The Medical Model. When did it go wrong and why? Because I think it has. And I think I can trace that right back to the 1970s. And for me, specifically 1979, when I started my training in medicine. So 45 years in medicine as a medical student or a doctor. And I trained in the era of Nixon's war on cancer. So Richard Nixon declared war on cancer. Billions were pumped into medical research to find the cure for cancer. The major cancers were going to be a thing of the past within 5 years. We'd already beaten infectious diseases with antibiotics. Chronic diseases was only a matter of time. So I was taught how to treat. I wasn't taught how to heal. I was a curer, not a healer. And I don't think it has significantly changed since then. Now, I actually titled my talk to the RACP, Healing for Doctors, which was deliberately provocative because a lot of doctors actually don't even like the word healing because it belongs to alternative medicine, alternative practitioners. And healing is very rarely talked about in medicine, which again is in contrast to nursing, I know. And a lot of these things you will say, I am sure you will say, but this is how we're taught. This is how we're trained. We know about the 4 pillars of health, but doctors by and large don't. As Helen said, I was a very traditional medical student, very traditional doctor, went straight into general practice in the UK, in the north of England. And I applied the medical model to my patients. My patients came in with something wrong with them. They told me their symptoms. I took a history, examination, investigations, reached a diagnosis, and treated them. If that worked and they got cured, then that was fantastic. But if it didn't work, then I could either monitor or refer or just maintain them in a state of chronic disease. And I left general practice in 2000, not because I was in any way disillusioned with general practice. I actually loved it. And in fact, the practice I worked in a village practice in the north of England, rural practice, we practiced family medicine. And I'm very fortunate to have had that role. But when I left general practice and became an occupational physician, because I developed an interest in the health of workers, I suddenly realized that the whole emphasis had shifted. It was no longer about finding out what's wrong with people and treating them. Suddenly it was about keeping workers healthy and helping them recover after an illness or injury and get back to work and rehabilitate them, and helping employers to look after their workforce. A whole different emphasis, which immediately started me questioning everything I had been taught in medicine. So I've been on a 24-year journey to get to this point. And I've been studying the fundamental questions of medicine. What is health? What is disease? What is healing? And how do people heal? Now, I've already said I was taught nothing about healing at medical school. And actually, I wasn't really taught what is health and what is disease. So these were all pretty new concepts to me, which is pretty amazing when you think of my time as a doctor and my medical student training. And actually, I think I'm probably going to stretch your thinking somewhat as well. But I warned the doctors in the audience that I was likely going to put them in a place of discomfort, a place of cognitive dissonance, because I was challenging their worldview, the way that they believe that medicine works. But for me, it all changed on the 4th of November 2003. I came home from work. It was a really gloomy autumn day in the north of England. I brought fish and chips home for tea. The children, Emma and Matt, were sat at the table. They were 9 and 7 at the time. And I said to Susan, I'm just going to sit in the lounge for a bit. She came in very quickly afterwards and said, oof, you don't look well. Shall I call the doctor? And I said, no, call an ambulance. I'm having a heart attack. And I was, and I had an NSTEMI. And I was put on all the medication, and thankfully I didn't need any interventions. And I made a really good recovery. 2003, fast forward 10 years, here's a picture of great happiness for me. This is me and my best mate in the world, Philip, playing chess on the beach opposite the Duke of Marlborough with a couple of pints, and yeah, great happiness. You will notice from my poku that that even though I was on the cocktail of drugs, I'd actually done nothing about my own health and well-being. And in fact, although this is a scene of great happiness, it belies another great sadness, because my marriage was failing and I was struggling with life. And soon after that, I encountered the dark night of the soul, and I hit the pits of despair and realized I had nothing to turn to, no thread of meaning and purpose in my life, no real connections to hang on to. But then the epiphany came to me. All of this meant that health is more than physical. Health is more than psychological. Health is more than emotional. Health is more than spiritual. Health is a combination of all four of them. And I realized that this is what Sir Mason Dury had been telling us since 1984 with the Mari model of health, Tifaritapa Far, which you all know really well. I call them the 4 pillars of health. Tifari Tapafar, literally the four parts of the house, or the four cornerstones, or the four walls, but I refer to the four pillars of health: physical health, psychological health, emotional health, and spiritual health. And as I learned from my own lesson, and I learned from my own patients and looking at their lives, I started to apply a new model of practice that I called positive medicine. And what I did was to take the medical model and combine it with Martin Seligman's positive psychology and the indigenous wisdom of the Maori and other indigenous people around the world, but also ancient philosophy, the philosophy of the Stoics, and talked about the four pillars of health in my book. I also talked about the people who had healed using this model. And I present a number of case studies, all of who agreed to have their own names, their real names, used in the book. So these were very genuine cases that I didn't even need to change the details of. People were really happy to have their story told. But I actually realized this was published in 2021. In 2022, it won the British Medical Association Medical Book Award for Primary Care. I tell you that not to gloat or show off, but because the judges of that competition were my peers. They were doctors. And I've had a lot of doctors who have been confronted by this model and challenged me on my thinking. But now, hey, I was invited to speak about this at RACP Congress. They want to hear what this is. But even after I'd written the book, the model continued to evolve. And I realized that there was a piece missing. I'd explained that people could use this model, that I could practice to this model and help patients heal. To be a healer, as far as I'm concerned, is to teach people how to heal themselves. How do they heal was the piece that was missing. And it's only in the last 3 years that I've realized what the answer is. And the answer is captured in the concept that comes from systems science, which is the study of the behavior of complex systems in the natural or man-made world. So believe it or not, the human body is not a linear, mechanistic cause and effect, find out what's wrong and treat it kind of principle. The whole concept of medicine, as I was taught it, was reductionist and simplistic. In fact, all living organisms are complex systems. The systems which we run our societies with are complex systems. Healthcare itself is a complex system. We all know that. Political systems, economic, even traffic systems and the way that traffic behaves is explained and predicted using systems thinking. Systems thinking says that complex systems are interconnected, they're non-linear, they're all controlled by feedback and feed-forward self-regulating loops. So, but not only that, not only is every system interconnected, but every system sits within a system within a system. So if we look at our lives are actually ruled by the systems of our society. But our lives actually, we carry out our lives with our human body. And within our human body, we have the complex system of the organs and the cellular function. But here's the magic. The magic is that all complex systems are complex adaptive systems. They have the ability to self-organize and maintain relative stability even as environments change. They have another major phenomenon attached to them, and that is the phenomenon. Oh, sorry. Oh, there we go. Sorry, I missed a word out. We know that we're a complex adaptive system. We know we maintain stability. We're taught it. All of our systems are maintained by homeostasis. I was taught homeostasis as a medical student, but I wasn't told what it is or why it is. Homeostasis is completely explained by systems thinking and the properties of complex adaptive systems. The other property I want to tell you about is known as emergence. The opposite of scientific analysis, or breaking wholes down into parts, is synthesis, where you combine the parts to make a whole that is greater than the sum of its parts. And the fact that it's greater than the sum of its parts means that it often will result in a surprise that can't be understood by understanding the component parts. So, for instance, if you look at a chrysalis, do you know what's inside a chrysalis?
Caterpillar?
No. Do you know what's inside a chrysalis?
Literally melted goop, which is astonishing.
Yes. Thank you. That is you are the first person who has answered that correctly.
I feel very identify with that process.
Yeah. Yeah, I think the technical term for it is mush. He said in his best Northern English accent. But it's not a caterpillar, it's not a butterfly. But as it continues to organize and self-organize, the emergence is the butterfly. So a caterpillar auto-digests to form mush, which then emerges as a butterfly, which you could not predict from knowing the component parts. The same with a beehive. You could not predict a beehive from the behavior of bees, or a termite mound from the behavior of termites, or a murmuration of starlings from the behavior of individual starlings. This is emergence. This is so important to understand because we are now seeing research and thought leaders who are starting to say that health and disease are emergent states. Diabetes is an emergent state. Cancer is an emergent state. A couple of papers there explaining this phenomena in very great detail and very, very convincingly. So this isn't just me, but there are not many people around the world actually saying this or even realizing this. Increasingly, the definition of health is evolving. And here's a great definition that I found recently, but it's actually from 1921. Health is the dynamic balance of physical, mental, social, and existential well-being in adapting to conditions of life and the environment. The first thing I love about this is the fact that it talks about the 4 pillars, and it talks about existential well-being rather than the expression that Sir Mason and I have used, which is spiritual health or wairua. Existential well-being, like that. But look at this. If you look at that definition of health, and you look at Professor of Physiology, George Billman's definition of homeostasis. Homeostasis is a self-regulating process by which biological systems maintain stability while adjusting to changing external environments that allow it to adapt and to survive in the face of a changing and often hostile external environment. They're very, very similar. And actually, it is quite easy to reduce this to the statement, health is homeostasis. And actually, there are now, Professor George Billman is also saying disease is disrupted homeostasis. That's all it is. And then what is healing? Healing is restoring homeostasis. Oh my goodness, who could believe it was that simple? The fundamental questions of medicine. But because of systems thinking that says that the systems of our body exist as systems within systems within systems, life homeostasis, nobody else is talking about that. I've coined that expression. Life homeostasis is about finding control and balance in our own lives, which results in the creation of control and balance in our organs and our cells, and therefore healing. Would you believe I'm nearly finished, and I'm really happy to take questions. I've got a case study here of healing in prediabetes. N equals 1. And this 1 happens to be me. So in 2013, which was actually the year of that photograph that you saw of me and Philip, I was diagnosed with prediabetes with an HbA1c of 42. And my GP said, we'll have to monitor that. And every year I went back and had my HbA1c monitored and watch it climb. And in January 2023, I went to my GP and he said, your HbA1c is 47. We'll have to monitor that. And I thought, oh my goodness, what is he waiting for? He's waiting for me to hit 50 when I can be diagnosed with type 2 diabetes and be put on therapy. He wants to treat me. What could I do? So I went to see Dr. Glenn Davis, who was GP of the Year 2022 for reversing type 2 diabetes in 150 patients in Taupo. And Glenn said, this is straightforward. We can manage this. You need to go on a therapeutic carbohydrate restricted diet. Within 3 weeks, my HbA1c was 40. And within 6 months, it was 34. The HbA1c of a 30-year-old. He calls it reversal. Reversal of diabetes is becoming increasingly talked about around the world, but in reality, it's only small pockets of doctors who are practicing it. Reversing type 2 diabetes, reversing prediabetes is actually simply healing. It is simply creating the circumstances to restore homeostasis. So at that point, I'm going to stop and just open this up for questions to see where we want to take it.
Thank you, David. That was amazing, as always. We're having Glenn to come and speak to us, so we're very blessed. I managed to corner Glenn, and he's going to come and have a chat with us in a couple of months as well. So we're very excited about that. I think one of the questions I had, sorry, I know other people will be thinking of questions too, but what do you hope the new model of medicine will look like? Because, you know, we know the state of the medical model and GP practices is not looking robust at the moment. And I'm wondering what your thoughts are about what a new model might look like, and also actually how as we as nurses, what can we do to support a new model of medicine?
Yeah, thank you. Thank you for that.
There are
Helen.
some doctors here too, actually. I know there's some doctors here, so yeah.
Oh, excellent. Excellent. Hi, Robin. You must be a rebel as well then, to be in this group.
Yeah, I'm a psychiatrist rebel, actually.
Cool.
I studied nutrition and psychology before I did medicine, so I felt really outside of the medical model when I studied medicine for a long time. So nice to meet you.
Nice to meet you too. And in fact, in the 1970s, it was a psychiatrist called George Engel who said, "Oh my goodness, we're just getting psychiatry so wrong. We're pathologizing it, and we're trying to find out what's wrong with people and treating them." And it was George Engel who, in 1976, I think, proposed the biopsychosocial model, which is now extended quite often to being the biopsychosocial spiritual.
Yeah.
Yeah. So we've got the 4 pillars. Helen, you said general practice is not robust. Oh my goodness. That is the understatement of the year. General practice is broken. It's in crisis. The doctors within the system are in crisis, and therefore so is everyone else. And the focus I'm hearing is on we need more doctors. And actually, I don't think we need more doctors. I think we need better teams. But I think the real solution here lies in the empowerment of patients to take responsibility for their own health and develop a whole person health and healing plan with the help of the practice team. And I think this is absolutely where nurses and health coaches and the whole team comes in. So I was reading about a model of primary care in the US where the ratio of doctors to health coaches is 8-1. Actually, I've deliberately said that wrongly because there are 8 health coaches to every 1 doctor. And it's an empowerment model. So I think the key is actually teaching patients, is actually shifting worldview, is to help people realize that there is far much more that they can do to take control of their own health and indeed their own life than people realize.
Fantastic. Thank you. Kate, did you want to ask something?
Yes. Hi. Thank you. Much appreciated. And it's actually really, it is empowering to have people within the medical model coming to the same conclusion that many of us came to maybe 20 years ago. And so I think you're right that nurses, because we sort of fill in the gaps, we've kind of figured a lot of that stuff out. But like people like Helen and some of the other people on this group, so I have a private practice myself and I work in obesity. So I actually hold space in a nursing space. And a lot of what I'm doing is helping people sit in homeostasis in what's considered a disease process that is extremely shamed. And there is a lot of medical bias. So my whole patient cohort have quite a distrust of the health system. So if we're talking about being disruptors and we understand these models of care, how do we collaborate so that we're not siloed and sitting out here doing kind of, I don't want to blow my own trumpet, but I'm kind of doing some really important work, but because it's not integrated within the health model and it's too hard for referral systems, and we have this whole pattern of the only way we get healthcare, and then if people don't advocate for themselves, they just fall down the cracks. So how do we who are sitting out here being disruptors, how do we collaborate and do this collectively rather than in these silos is my question.
Yeah, and actually there was a lot more to your question than just that, Kate. I heard a lot that resonates with me in there. I mean, the answer is that people like Helen are helping to create the environment where we can come together. Within positive medicine, we've developed the Positive Medicine Academy, which is specifically helping healthcare professionals, doctors, nurses, psychologists, psychiatrists, emergency care physicians, health coaches, bringing them all together and teaching them the positive medicine model and training to that model. So there's another environment there. And I think the cross-pollination of bringing us all together like this and having these discussions is really important. I agree with you. It is very important to have doctors working within the system saying the system's getting it wrong. And 11 years ago now, in 2013, I was too scared of my own colleagues to put my hand up and say, guys, we're getting it wrong. Gender neutral, guys, we're getting it wrong. But I have no fear now because there are so many people who are agreeing with me, even within the medical profession. And I know nurses were way ahead of the curve. And I think I'm going to say it. I think there's a lot of healing to be done in the relationship between doctors and nurses as well. And I think the medical model has got a lot to blame for that, because doctors were given the power for the very reason that they were the curers. They were the ones who diagnosed and treated with a view to cure. But what we've never acknowledged the fact that it just doesn't work in chronic disease.
So what I'm hearing you say, so if we look at, say, the difference between a hierarchy and a heterarchy, so we've got a flat system.
Yes.
The medical model is a significant hierarchy. And when you were talking about the systems, like each of those hierarchies have gone off into their own space to just deal with the physical. But I think most nurses understand that holistic approach, but it's become it's kind of a word that we don't want to say, but it's actually fundamental to how we approach the patient.
Yeah.
Can I just, sorry, did you want to say, Peter? David?
Yeah, I was totally going to agree with you. And I actually personally don't use the word holistic because it's been somewhat hijacked and maligned. So I talk about whole person health. And I talk about the practice of medicine, the art of medicine being to apply the science in the context of a person's whole life. And the only way we can see conditions like obesity is in the context of a person's whole life. Their whole life as it is now, and their whole life as it has been ever since childhood. The roots of obesity often lie in childhood.
Yeah, what I was going to say, I work in general practice as a practice nurse. And I've had many years, slightly longer than yours, I think, David, in the health field. And in the last 3.5 years in this field, it's been the most rewarding of my whole entire life, of all the different nursing roles I've taken in all shapes and sizes, because I am able to become an autonomous, holistic nurse with great support from the GPs. And now they have a health improvement practitioner, which I think a lot of the GPs have. So between us nurses and the GPs and the HIP practitioners, then these patients are virtually passed around to, in a good way, and have relevant discussions about, dropping their HbA1c in a meaningful way. Like I just had a great example today of a lady who's a newly diagnosed one. She has been monitored. Fortunately, hasn't gone up that as far as yours was, but got up hard, almost there, and just, been straight on metformin. But hasn't, and it's the first time that us as nurses have really known about this patient. And she was referred to go and have a chat with the nurse about it. And I thought, and her GP wasn't there today. He's away this week, but I'm going to have a chat with him about being really good if 2 or 3 years ago, she had been referred to have a chat with the nurse, because she just found my discussion so meaningful, and I'm no specialist in nutrition or anything, but I made little notes as I was going to explain things, and she said, can I take those with me? And it all meant so much. She was just blown away, and it was just a 10-15 minute conversation, whereas I thought she should have been referred to the nurse for a discussion, or somebody like me, probably 2 or 3 years ago, as they were monitoring her blood sugar. So I'm gonna bring up this discussion now. We have a weekly meeting, and on a Monday where most of the GPs are there and the nurses, and I'm going to bring this up, and I might bring up this discussion and say that I just think if you're monitoring a patient, get them straight to having a discussion with one of us.
Brilliant.
I think I'm really pleased. They're a very receptive bunch of GPs, so I think it'll work well.
The solutions are here, aren't they? And we only need to amplify what's working and diminish what's not working, and we won't go far wrong.
But
that's so empowering for the patient. Sorry, it's so empowering for the patient. And that's one of the things I'm so passionate about, is that when people have the information, so often they are keen. They're like, I had no idea, and I'm like, how have you got to this place and nobody explained this to you? So, that empowerment is so important.
But what's incredibly frustrating is that this whole progression is so incredibly slow.
Yeah.
I've been nursing for 51 years now, and 24 of those years were in general practice. And like you, Vicky, I was fortunate enough to have an employer that allowed me to run my nurse-led clinics in nutrition, smoking cessation, reducing cardiovascular risk, all that sort of thing, and which I really enjoyed. And I basically set up my own clinics and looked at the people that were in these cohorts and brought them in and spoke with them. But and that was probably 20 years ago. And then 10 years ago, I attended a week-long course with ACNEM, Australasian College of Nutritional and Environmental Medicine. Now, there weren't many nurses there. There were dentists, pharmacists, and quite a few doctors. And all the doctors said at the end of the week, why aren't we getting this? Why haven't I heard this stuff before? Why haven't I been taught this in med school? And that's the really frustrating thing. Why aren't they getting this knowledge given to them in medical school? Now, who's lobbying the medical schools to bring this in right at the very beginning of doctors training? Because that's where it starts. It's such a common sense solution, really.
Same with nursing training too, I have to say. Nursing. I trained a long time ago now, but it was. I don't remember getting any training on nutrition or health. We got a bit on spiritual health. Kate, you will remember, Kate and I trained together. It was very, I think in my mind, it was very medical model based. Probably a little bit more outside, but yeah, still.
So how are you going to speed this process along? How are you going to do that?
I teach second, sorry to interrupt.
Yes, go, Robin.
I teach second and third year medical students at Auckland Med School in the personal and professional development course, and there's a little bit of a hope there from what the curriculum is being taught there. There's a lot of stuff about spiritual health, cultural competency, caring for yourself so that you can care for others, and I use a little bit of my own kind of, there's the curriculum, but I use my own little bit of like putting in the integrated way to
Good
on you. Squeeze it in, Robin.
So I love doing that work because I just feel that there's a lot of hope, and a lot of the medical students feel that way. So I think, and I agree with you, David. I was very silent for a long time in the medical model, felt really out of place, and now I'm like, what have I got to lose, actually?
Yeah, exactly.
Yeah.
And I was afraid of being criticized by my colleagues.
Yeah.
But now I think it has shifted so much that it is so obvious to the general public at large that the medical model doesn't work for patients. So unfortunately, GPs, many of the traditional GPs are becoming outliers in their old school thinking. And we've got to be very gentle how we bring them along with us. But I also have a lot of hope. And yes, medical students are being taught a different curriculum now, which is fantastic. But like Trish, I don't think we should be waiting 20 years for them to get into more senior positions. We need to find the tipping point. We need to shift the paradigm. And combining voices is definitely a way to do that.
It kind of feels like in medical school that you're teaching this, but then you kind of putting them into the lion's den when they get into medicine, and that they have this kind of feeling of how things should be, but then the culture of medicine soon wears them down. Yeah.
Slow to change.
It feels a bit kind of like at times you feel a bit sad for their journey in a way.
Well, let's change that for them. Let's do what we can in advance. Don't talk to Glenn Davis about this, because he's very disillusioned by the way he was treated by doctors in Topor, having been voted GP of the year by colleagues. None of them were his own colleagues. He struggled to get this message through.
It's incredible, isn't it?
Yeah.
It is incredible. And can I just put a plug for you, David? I think that the Positive Medicine Academy is actually worth taking a look at for anybody that really does want a more sort of collegial, disruptive way of doing medicine, to join that and actually be part of it. I think it is one way, Kate, you were mentioning about integrating and actually coming together and having a place that we can actually get support and meet other people that are like-minded. I think that's a great place to be and start. And Kate, I hear that you've got a question as well.
I think I just wanted to pull a strand together. So I've just finished the Gabor Mate Compassionate Inquiry course, which is, he's singing from the same song sheet, and he's 80, but he's really talking about empowerment for patients and within the medical model, learning the role of the therapeutic process. And I think that was really, really fundamental. And listening to what you were saying, Robin, it's our young nurses and our young doctors who do go out into the lion's den of a hierarchical environment. That happened to me. I've been bullied. So that's that oppression cycle, which we can teach. But I think recognizing the difference between the therapeutic approach, where we're actually allowing people to do their own autonomy and healing, versus that I'm here to fix you, cure you. I think that's a fundamental shift that is I'm seeing in the younger doctors, and not so much with my peers and colleagues who are of my ilk, should I say, or my age. So I do agree with you, Robin. I think that a lot of the younger practitioners in all walks of health are learning what a therapeutic relationship is and learning that self-care. That's fundamental. I wasn't taught that as a child, like Helen was saying, it was what I did to people. I got into people's spaces and fixed them or helped them. But that self-care model says, hang on, this is an individual that requires me to be checking my stuff and to be holding space for them. That's been huge for me, and I can see that's really positive.
Yeah, great points, Kate. Completely agree with you. Completely agree with you. And of course, Gabor Mate relates a lot of the root cause of chronic disease to childhood trauma. So there's a thread there as well. And in fact, I have my own consultation style that I train, which is called empathic immersion, where you meet that person, you feel with them, protecting your own boundaries, but you actually immerse yourself in their story and their lives. and allow them to feel safely, so that they can explore themselves and where they're at and come to their own insights and conclusions. So yeah, thank you for mentioning Gabor Mate.
Awesome.
And yes,
Any
so
yes.
www.positivemedicine.com. We have a free positive medicine community, and the academy comes out of that. Currently, the first month is free, and the training to become a positive medicine practitioner is also free. I would be remiss not to mention that. And of course, and it is entirely possible to do your training within that first month. There's, I think, 2 hours, 40 minutes of instructional videos plus self-reflection time. I do hear some very positive feedback about the experience of going through the training and the empathic immersion. Thank you for allowing me to plug, Helen.
Yes, no, I think it's important. I think, that's part of the reason why I got you here as well. And I just said that Jackie has just said that she's just joined Positive Medicine. So there we go. You've got another nurse
fantastic. Fantastic.
And Jackie's a mover and a shaker. She's doing amazing things as well. She's another disruptor.
Excellent. Hi, Jackie. Great to have you on board.
Hi, sorry I've come in late. I'm in the midst of doing a big fundraiser for Hart Place Hospital, so multitasking.
All
Hi,
good.
Jackie.
Lovely to have you here. Awesome. Are there any other questions or anything else that people want to sort of comment or say? We might all touch base in the positive medicine world as well. Thank you very much, David, for your time. I very much appreciate it. And it's been great meeting you and being part of this movement. I feel like I've found a little bit of a home. As I've said to people, I've sort of bumbled around the last 10 years, trying to figure out, what I can do and who can I hold on to in this different way that I've been wanting to practice psychiatry. So it's been lovely to meet you, and obviously there is more now coming, I'll say, out of the woodwork, happy to raise their hand and be noticed, and it's quite an exciting time, I think.
It is, yes. A big shout out for the disruptors. We need to club up together, and yeah, that's right. Yeah, we're doing good work, and well done you, Helen, for bringing this group together and just encouraging people to stand up for what they believe in, because at the heart of all of this, this is all about humanity and how we can contribute. This is spiritual health.
Yeah, it so is.
Cool.
Fantastic.
Thank you very much, everyone.
Thank you very much.
Thank you very much, Helen.
Thank you. It's been fabulous.
I'll put the recording up onto the Facebook page. So awesome. Lovely.